On April 7, 1948, the World Health Organization was born. Addressing malaria, tuberculosis, venereal and other communicable diseases, improving health of mothers and children, nutrition and sanitation were top priorities, globally. The vision was to promote health, described as a state of complete physical, mental, and social well-being. Months later, on 15th of November, the World Health Organization Southeast Asia Regional Office was set up in a small office in a Government of India building in New Delhi. The public health scenario then was grim. Malaria was rampant. Tuberculosis killed over 500,000 people every year. Smallpox reigned. Yaws afflicted millions. Plague and other communicable diseases were common. Doctors and nurses were scarce and health facilities specially meager in rural areas. To the global priorities, WHO in the region added health education, fellowships and lymphatic filariasis as key programs. The journey that started 75 years ago was marked by many challenges, old and new, and a strong perseverance to overcome them. Persistent, collaborative efforts and strong partnerships were witnessed to strengthen public health, to strengthen public health education, to build health workforce, to develop public health infrastructure, to build capacities for evidence-based health policies and strategies, to build and strengthen capacities to respond to outbreaks, disasters, and health emergencies, and to generate research and evidence to improve effectiveness of health initiatives. The region, which remains central to global public health with 1/4 of the world's population, made significant contributions. The concept of primary health care, on which the 1978 Alma-Ata Health for All by 2000 was adopted, came from Indonesia way back in 1937. The ORS, oral rehydration salt solution, was a contribution of scientists from Bangladesh and India which has helped save numerous lives. The region researched and contributed the bivalent oral polio vaccine that brought the world closest to polio eradication. These were among the many path-breaking contributions. Like initiatives, there have been many successes. Eradication of smallpox globally in 1979, a year after the region achieved this feat, is the most significant public health achievement till date. In 2014, the region adopted 7 flagships, to which another was added in 2017. These flagships are driving substantive and inclusive gains in health and well-being. The same year the region beat polio, the most important public health achievement in the last decade. The region achieved elimination of maternal and neonatal tetanus in 2016. All countries in the region reduced leprosy cases to less than 1 per 10,000 population, achieving elimination standards at the national level by 2011. By 2015, malaria cases were halved, and deaths reduced by 90%. HIV epidemic was reversed, and cases halved by 2015. Prioritizing expansion of health workforce, countries today have trained health workers as per WHO targets. Maternal, under 5 and neonatal mortality rates have reduced substantially, with countries achieving the MDG goals. Multi-sectoral efforts and innovative measures continue to be rolled out to tackle the growing numbers of non-communicable diseases, address communicable diseases and antimicrobial resistance. The region witnessed 18 eliminations around the regional flagship priorities since 2014, with countries eliminating malaria, measles, rubella, mother-to-child transmission of HIV and syphilis, yaws, trachoma and lymphatic filariasis. Prone to natural disasters, the region pioneered a dedicated emergency fund, SEER, and a series of initiatives from benchmarks to roadmap, learning from the mega public health emergencies such as the 2004 tsunami, Cyclone Nargis, 2015 Nepal earthquakes, the Rohingya crisis in Cox's Bazar and the recent COVID-19 pandemic. The region has emerged as the leading manufacturer of vaccines and therapeutics, helping save lives of millions of people across the world. Several innovations, technologies, improvised strategies, plans and many more mark the 75-year-long journey of public health in the region, and continue to do so, with the region taking a giant leap forward, especially in digital technology, strengthening primary health care in the quest to achieve universal health coverage. Most marked and critical aspect of the journey has been the strong leadership provided by member states, concerted efforts of partners and players beyond the health sector, and the invaluable contribution of health workers and the community. Today and always, WHO salutes you and thanks you for your trust in the organization. We have been together striving for health and well-being of all, and will continue to do so as we continue our journey to sustain, accelerate, and innovate to ensure health for all, everyone, everywhere.